With regard to health checks and investigations for women over 40 before they start IVF or IUI or some kind of fertility treatment, um, what checks do you think are essential for women to undertake? Because every clinic has a certain list of tests they want you to get, and they seem to vary widely.
Yeah, they shouldn't vary widely. So there's no question that the testing should be standardized and it's simple. So on the male side, you want to get an infectious disease screen and you want a comprehensive semen analysis, which I would argue more and more should also include sperm DNA fragmentation assessment. On the female side, we do a comprehensive assessment with a full analysis of one cycle. So we'll do multiple hormone tests, including FSH, LH, estradiol, throughout, probably 4 or 5 markers during the first 2.5 weeks of their cycle until they ovulate. And we'll monitor how long does it take to make the eggs? How many eggs are there? We'll do transvaginal ultrasounds at the same time and see how many eggs are growing, how many are releasing, how many are maturing, what's that pattern look like, what does the endometrium look like, how thick does it get, how is their progesterone, how high does their progesterone get? So all of those things should be looked at very carefully. In addition to that, we do more comprehensive assessment of the hormones. So we'll look at DHEA, testosterone, AMH. We evaluate vitamins. So you should be looking at the patient's vitamin D levels, their B12, their ferritin. You want to look at their basic blood work. So how high is their hemoglobin? What blood type do they have? What's their metabolic performance look like? So cholesterol, insulin, fasting sugar levels. And then you need a saline infusion sonohystogram, which is the ultrasound version of an HSG or hysterosalpingogram. The ultrasound version is much less painful, gives you way more information, is much more detailed, and requires no radioactivity. And so that's another test that should be done. I cannot tell you how many UK-based women I've met who have never had an investigation of their fallopian tubes or the shape of their uterus, which is, to me, just maniacal. It's bizarre. It does not make sense whatsoever at all that women are not having those evaluations. You could go through countless treatments with horrible results and then find out, oh, I have a T-shaped uterus or I have a Y-shaped uterus, and that's my reason for failure. So these investigations should all be very comprehensive and they should be offered to all patients. It should be standardized. There's no reason not to standardize the investigations.
Mhm.